puts the cold heart through. Everyone really want to know what's going on with her show. Just get on the air and you will know it's Sandra. The queen of the mile road is here, helping people from everywhere. Get on the phone and you will hear Sandra. Now she will tell you how it goes, but don't you ever step on her toes, 'cause you will hear the cold hard truth from Sandra. They say she's the hero in town, helping people from all around. You get a call, your money is found, it's Sandra. Some will call her late at night just to say that there is a fight, and she will not just leave it alone. She'll get up and call on the phone, and when politics starts on her show, everyone really wants to know the way the things will really go with Sandra. And some will start to criticize, get on the show and tell pure lies, but someday we'll realize it's Sandra. And when they start to argue again, she'll pull the heads to the wind, and soon you will be a friend of Sandra. 'Cause every day everyone wanna hear from Sandra. 'Cause every day everyone wanna hear from Sandra. 'Cause every day everyone got to hear from Sandra. 'Cause every day everyone got to hear from Sandra.
Good morning, good morning, good morning, K-Man. Happy Tuesday. How is everybody doing this beautiful Tuesday morning? Hope you guys are well. Lots to talk about today. So much happening in the world these days. Is it just my imagination? Or does there seem like there's just a lot of news these days? Well, we are here for it. Do not fear. We got you covered, as always. Of course, today is Tuesday, though. So the first bit of news up is education, medical education. Yes, Health City is in the house for Medical Rundown Tuesday, and they are going to share their wisdom with us. And we are prepared to learn. I feel like we're munching and learning. Some of you are munching in the mornings, and others are just, having your cup of coffee, having a cup of tea, maybe some Milo. Not sure what your beverage of choice is these days. But whatever it is, warm it up and let's get it, because it is an absolutely gorgeous day and we enjoy having these conversations. I know that you guys do because I'm always getting, feedback on exactly how these segments are educational and how much you appreciate them. So some people don't comment as they're listening or even on the show. But what I do know is that a lot of you are still very, very interested because you messaged me afterwards. You remain a little bit shy, and that's okay. But wow, Sandy, I really enjoyed that menopause discussion. Sandy, I've been thinking about my weight loss journey and maybe I need to go talk to someone. So all of these conversations are very, very important. They're related to your health. And I can tell you that, my apologies, no radio. Hold on one second, honey chill. That's my fault this morning. Give me a second. Here we go. I'm going to click on it right now. There we go. All right. That was all on me. Okay. So I think we should be on. Let me know. But yes, thank you guys so much for telling me that, by the way. So many tabs open, you know. But I know how much you guys really enjoy it because you're always reaching out and sharing your stories in terms of what you find interesting and how much you learn. Shamari's in the house. Let's put our virtual hands together for Shamari Scott. Good morning, Senor Shamari. How are
Good
you?
morning, Sandy. How are you doing today?
Oh, we're doing great over here. How about you?
I am amazing. Can you hear me well? Because I have
Yeah.
a different setup today, and I know sometimes you're not able to hear me. Okay, good.
I can hear you loud and clear. Everything sounds crystal clear.
As you said, the world is going crazy, but I'm having an amazing week and an amazing day.
Oh, fantastic.
So we did not lose last week.
Yay.
The game was rained out, so
Well, it's still not a loss.
Yeah,
It's still not a loss.
we didn't lose. We didn't lose in the over 40 league.
Yeah.
WB 40 Hicatees are rearing to go for next week. So we have a bye. With us more mature people, they have to give us a little bit of break every now and then. So we have a bye this week. So we will play next Wednesday, not tomorrow. So guess what? Next Tuesday also won't have a loss. So that'll be 2 weeks in a row without a loss, seeing as we have a bye. But everything is going great on my end. It's an exciting day. Today, we're here to discuss something that everybody needs. And at times, people wear it as a badge of honor that they get little or no sleep and they can still function. And that's not a good thing. And we'll hear about that shortly. But it's our pleasure because we're going to have Dr. Archita as well as Dipesh on the program. Dr. Archita nor Dipesh are strangers to your program. But just because World Sleep Day was Friday that passed, thought it was time to bring back our specialists on CMR. So Dr. Archita is our pulmonologist that everybody knows, our consultant pulmonologist. She has, however, 2 decades of specialized experience when it comes to sleep disorders. She was certified by the World Sleep Society as an international sleep disorder specialist. And obviously, she has a whole other list when it comes to pulmonology. But seeing as we're dealing with sleep today, just wanted to highlight that, as well as Dipesh is our clinical sleep health specialist with over a decade of experience. And he also is our polysomnographic technologist, clinical sleep health specialist, and clinical sleep educator. So he has all of those titles and experiences. So they formulate our sleep lab as well as our team that helps people with their sleep. And today we'll understand why it's critical, what defines, healthy sleep, as well as associated with poor sleep, which a lot of people don't quite understand a lot of times.
All right, folks. So let's go ahead and put our virtual hands together for Dr. Archita. First of all, good morning, ma'am. How are you?
Good morning, Sandra. I'm fine. Thank you. It's always a
So
pleasure
good to see you.
Yes, with you.
Thank you so much. And Dr. Dipesh, I think I'm mispronouncing that slightly. Say it again for me, Shamari.
Well, me and my Caymanian pronounce it, but Dipesh is what I call him. I hope that's correct. After years, sometimes people correct me and say, that's not actually how you say my name. But that's my Caymanian, that's the Caymanian version. I was like, okay.
Want to make sure I'm putting the emphasis on the right area there. Dr. Dipesh, good morning, and thank you so much for joining us as well.
Good morning, Sandra. Good morning, Shomari. Good morning, ma'am. And yes, you're pronouncing it correct, Dipesh. That's fine.
Thank you so much. So, World Sleep Day. Wow. Where do we begin? Because I feel like there's probably so many of us that struggle with sleep on a regular basis. And, we don't appreciate, first of all, how important sleep is. And I guess that's really the importance of World Sleep Day, which was celebrated on Friday, March the 13th, raising awareness about the importance of good sleep for overall health and well-being. And let's talk a little bit about that then, Dr. Archita. Or Dr. Dipesh, whoever wants to jump in.
Well, Either one, that's fine. I guess we all know that sleep is a very important component of our life and of health. So among the pillars of health, talk about diet and exercise, but sleep is an equally important pillar which supports good healthy living, promotes healing and repair in the body, and allows us to live a more fulfilling or a healthy life. And I'm quite sure for anybody who's experienced some lack of sleep, they would be able to vouch for it. But if you haven't had enough sleep, you can have a terrible day ahead. Or if you've been skipping on sleeping or have accumulated what we know as a sleep debt, your quality of life significantly decreases, focus and attention decreases. But also it has a bodily harm and physical harms when we are sleep deprived. So sleep obviously is extremely important, and all of us, as humans or primates, we are we sleep for a third of our life, technically, or should be at least.
Yeah.
So 8 hours out of 24 is what is the recommended amount of sleep. And so anything that affects a third of your life cannot be something to be taken, for granted or taken lightly.
Yes, more and more, I myself am just reading up and learning how important this is, because even in terms of, like you said, you could literally be doing everything else right, and if you're not getting sufficient sleep, then unfortunately, that's going to have a severe impact on your health. And the research I'm reading actually says that it's so critical, which I think is fascinating, but it's so incredibly critical that whatever efforts you're making in terms of, diet and exercise, you could literally be undoing all of that, even if you have the perfect diet, which I know none of us do, but you could be undoing all of that hard work simply because your sleep is not optimal and not where it should be. So for me, that's a very scary proposition, because I know that I'm not the world's best sleeper. And so I'm tuned in today to try to learn certainly as much as I can about how to become a better sleeper. So let's get into it, because we hear all sorts of advice out there, and the good doctors from Health City are here to give us what is factual advice and good medical practice at this particular time. So let's define what quality, my apologies, what quality sleep actually is.
Quality of sleep is when you are able to, fall asleep fairly reasonably quick, have a more or less uninterrupted sleep, are able to maintain it for the whole of the night or when you're sleeping, and you wake up refreshed. I think that is the most important way of judging it for a common person. That if you've been able to sleep fairly quickly when you try to go to bed, and you wake up refreshed in the morning and do not feel tired and sleepy through the day, that should be a good enough assessment. Now, in technical terms, we can talk about this as sleep latency, maintenance, or how often are you awake after sleep onset, and how good is your sleep efficiency. But for a common man, the most important thing is how do you wake up? Are you feeling tired? And do
Yeah.
you get several times at night? And through the day now, when you're having a dull moment, do you feel like you are always a little groggy? You're finding it difficult to focus at work? For students or young children and adolescents, are they sleeping in class? Are the teachers telling us about they're not being able to focus at school? And these are simple things that will tell us about quality of sleep.
Yeah. What portion of the population do you think realistically is getting quality sleep? Like meeting all of these, sleep latency, sleep continuity, wakefulness, sleep efficiency.
Very difficult to say, but I
Yeah.
guess that is why this, especially in terms of Cayman, but general terms, when we look at least a third of the people, or at least 30% of the people experience some problem with, difficulty in sleeping or poor quality of sleep world over. There could be many more who don't report it or where it goes undiagnosed. There are some sleep disorders which go undiagnosed in most of the people. They're diagnosed in only about maybe 10% of people. So obviously it's very subjective as well. However, that is the reason behind this awareness programs that we run. And recently, for this World Sleep Day, I think Deepesh and Shumari's team, and we have come up with plan to roll out a survey where we've asked people, about their sleep timing and whatnot. So I think hopefully we'll have a little more data if people are joining the survey online, and we'll have more information. Deepish, maybe you can talk about it.
Like there is a very limited amount of need and want. The only difference is here, because if you are diagnosed with, for example, diabetes, and then you will go and start treatment immediately. But if someone is diagnosed with obstructive sleep apnea, they wait for 10 years to actually get the treatment.
Wow.
On an average.
On an
Yeah.
average, yes.
Oh my gosh.
This is where it lags.
Yeah. So people ignore sleep issues for a very long time before they seek medical intervention.
True.
Huh. Very interesting. All right, folks, important not to ignore it because it's affecting all areas of your life. Let's talk a little bit about the global burden. We do have some figures and some idea of what's happening worldwide, as well as the quote unquote metabolic cost. Can you explain to us what this global burden and metabolic cost is all about?
So, like we mentioned, we talk about financial debt and we talk about global crisis with shortages of this and shortages of that, and the price of these commodities going up in the recent context that we were talking about. We do not understand the cost of lack of sleep in our lives, and this is a worldwide problem. People who are sleep deprived or who are having shorter duration of sleep or disrupted sleep or sleep disorders will accrue what we know as a sleep debt, and they will have this cumulative lack of sleep, which then starts affecting not just their quality of life or their cognitive function or how awake and alert they feel, but also has a toll on their metabolic health. Now, cardiometabolic health is a very important thing. In simple terms, basically lack of sleep can contribute to developing weight gain or obesity. A huge factor in weight management as well, like you talked about in the previous interviews that you had with Health. And again, it increases the risk of other metabolic conditions like diabetes, heart failure, irregular heart rhythms, high blood pressure. It can contribute to developing indirectly, obviously, to strokes because of high blood pressure, arrhythmias or irregular heart rhythms. So in short, and then of course metabolic syndrome, which is a conundrum with a lot of these metabolic conditions associated with obesity. So lack of sleep or poor quality of sleep is a huge contributor to these. And lesser the sleep, the more the risk. And there have been some studies which have shown, especially in terms of diabetes, people who sleep too much or over what is good for an average adult may also have increased metabolic burden. So both short and very long sleep can be a problem. And so being in an optimal zone where you're getting good restful sleep perhaps is the solution to reducing your metabolic burden. Lack of sleep.
Yeah, I think we're going to do a poll question today because I'm so curious. I have someone message me said that I want to hear everything because I'm such a bad sleeper. And I wonder how many people recognize that they are struggling with sleep. So I'm going to put up a poll question in the channel around this sort of topic today. Do you feel like you're getting optimal sleep even 90% of the time? Because maybe it's not every single night, but do the majority of you feel like you're getting optimal sleep? I'd be curious to see what kind of results we get from just polling that smaller community, but nonetheless, some good numbers there. So participate in this morning's poll. I'm just going to put it up here in just a second because already I'm getting messages that say, oh boy, Sandy, I know I'm not a good sleeper. Lucky Body says my Apple Watch helps me keep track of my sleep pattern and recommends when I should improve my sleep. So obviously we're going to talk about the things that people can do, but I think it is great that there are tools now, Dr. Archita and Dr. Deepesh, that we can utilize in our day-to-day lives that can certainly assist and help us. And I do remember, before the Apple Watch was like the thing, we had the, what's it called? We had the Vera was one of the models. Oh gosh, gotta help me out here. I know Melanie's listening. Go, yes, our watches. But anyway, there's another brand that
There
we
are many
used to.
fitness trackers and wearable devices these days. I mean, there's no dearth of watches and bands and
Yeah.
rings that can help you track sleep without
Oh yeah, Fitbit.
any commercial versions.
Yes, we used to be into the Fitbit before Apple was a thing, watches. But anyway, I do recall the very first time the Fitbit gave me results on my sleep, how shocked I was at how many times I am, getting up or moving throughout the night and having very, very disruptive sleep. So yeah, I mean, it blew me away. I was like, oh my gosh, like I kind of thought it wasn't the best in the world, but I didn't realize it was that bad. So let's talk about some of the benefits of quality sleep. Dr. Archita has already touched on some of this, but essential for both physical, mental, and emotional well being. When individuals sleep well, they are better able to function and perform in daily life. And I want to really make sure that parents are listening this morning because our children, most of our children, I feel like they're not getting enough quality sleep, even when you're trying to push them to be in bed by 8:30. It's the quality of sleep that you have to be mindful of for them also. So, healthy sleep contributes to improved memory, learning and concentration, better mood and emotional balance, higher energy levels and daily productivity, stronger immune function, better heart health and blood pressure control, which Dr. Archita talked about just a second ago. And I must say that, I think we've all recognized sometimes it happens when we're traveling or other things like that, and we're not really getting optimal sleep. All of a sudden we feel that tickle in the throat. We feel, a little sniffles coming on. And so there is a direct correlation between good quality sleep and actually your immune system. Dr. Deepesh,
Yes.
how many patients do you see walking in and they talk about other ailments, but they're not actually recognizing that it is connected to poor sleep?
Well, patients comes to me once they understand that okay, they have some kind of sleep disorders, and then they come here for a sleep study.
Mm-hmm.
So most of the patient, they already recognize or already be given fair information about their sleep disorders.
Mm-hmm. Yeah.
I mean, Dr. Achita would be the right person to tell you because she sees a triad of patients.
Yeah. All right, Dr. Cheetah, I'm just going to unmute you. I noticed a little bit of feedback from your mic this morning. I'm not really sure. It's almost like white noise. So when you're not speaking, I did mute you, but let me just unmute you now so that you can have a discussion about, how you're seeing this manifest in your patients that come in and see you.
Yeah, I had already muted myself while others were talking. Sorry.
Yes.
No, so that's true. So most patients will present to to a physician talking about their sleep-related issues. A lot of them actually do not mention sleep as an issue, but would have so many other things that they present with, which then point towards a diagnosis of a sleep disorder. A lot of times, their primary care practitioners and their internists, they will recognize uncontrolled metabolic disorders and then refer them to the sleep clinic. So there can be many ways in which patients or individuals may present with sleep-related problems. A lot of times they will just come and directly mention, or they've recognized that they're having a problem and can't fall asleep, can't stay asleep, or are snoring, or their partners have told them they're not breathing in their sleep, or they're very restless. They've been using some fitness tracker, which you talked about, wearable devices, which have become a big ally these days for physicians and sleep specialists all over the world. Sometimes allies and sometimes foes, but mostly they help people recognize or identify patterns. Where they see that they're not sleeping too good, or they see that their sleep is very interrupted, just like you mentioned. So that brings them to a consult, and then we talk about what's going on and try and identify the problem, and if necessary, do a sleep study or try and point them in towards solutions by just lifestyle modification. Like I said, other people will come with uncontrolled or resistant hypertension, or sometimes they come in with features of heart failure or poorly controlled asthma or repeated respiratory infections. I'm a lung physician, so then when we try and identify and chat and interview, we find out that there's definitely some issue with sleep, and that is making them more and more vulnerable to all of these things. So, and then that prompts identification or diagnostic workup for a sleep-related problem. So, if that was your question, I assume that present. So it could be variable presentations. Some people
Yes.
sit by psychiatrists because they feel depressed or they're having anxiety and that which is uncontrolled, and so we have to look for underlying sleep disorders. So from obesity clinics or weight loss clinics. So there could be so many ways in which an individual may present
Right.
for sleep consultation or for sleep related issues.
Wow. All right. Kind of sitting here wondering myself if I need to come and see you. Okay. So lots of risk.
Anytime, Sandra, anytime.
I
Just not for the
know.
resolution.
I know. We're gonna talk because more and more, I feel like there's certain things that I know I should be doing better. Like actually just getting to bed earlier would help. But yeah, if I can't correct it myself, maybe I just need to come and sit down with you and have a little chat about what else I need to be doing. Yeah. All right. So folks, there's no shame in admitting that you need help. Sometimes we know what we're supposed to be doing, but for whatever reason, we're just not able to put that in play. So that's why, the good team is here to let us know that their expertise is just a phone call away, a visit away. And then, it's not all about that they've got a magic solution for you. Sometimes they're going to just sit down and have a really good, this is my observation, they're going to have a really good, proper discussion with you about, okay, Sandy, come on now, you got to do this, this, and this. Let's see how you can implement some better habits. And that really is the key. But there are actual sleep disorders. And so it's not always just maybe poor habits. You could be suffering from a sleep disorder. And according to the International Classification of Sleep Disorders, there's more than 30, my goodness, more than 60 sleep-wake disorders. And we have a few common examples here. Wow, that's a lot. So let's talk about some of these. Insomnia. Dr. Deepesh and Dr. Cheetah.
So insomnia is where people have difficulty in falling asleep or staying asleep. Either it's perceived or true. They have poor quality of sleep or interrupted sleep. And almost, like I mentioned earlier, a third of people will report insomnia at some point in their life, that they've experienced that they couldn't fall asleep or couldn't stay asleep or had a terrible night. And this could be attributed to many things, including stress, anxiety, sometimes because of irregular sleeping patterns, but also associated with underlying sleep disorders. And what the individual experiences is symptoms which he or she perceives as insomnia or lack of sleep or poor quality of sleep. So that's why it's the most commonly reported sleep disorder, but it could have other contributing factors.
Right.
Then, of course, something that's very close to my heart and people, pulmonologists like me who start graduating into also practicing sleep medicine, is sleep apnea, which is a sleep-related breathing disorder, where individuals snore or shallow breathe or stop breathing in their sleep, and that leads to pause in the breath or lack of oxygen in the blood, and that the brain wakes that person up, and this leads to sleep disruptions. But this has one of the biggest implications on your cardiometabolic health, or it has the highest metabolic cost because it's contributing to a lot of physical as well as sleep fragmentation stress, but more importantly physical stress, where you're having a lot of cortisol surge and a lot of adrenaline surge, where you're having heart rate fluctuations, blood pressure elevations in sleep, and big contributor to many metabolic conditions we mentioned earlier. Then, of course, there are other spectrums. So there are people who can't sleep, and then there are people who sleep too much or have a pathological need for sleep, and those individuals may have what we know as hypersomnias in medical terms, or narcolepsy, which is a more commonly known form of hypersomnolence. And then, of course, in Cayman terms, I guess the term was dropsy, that a lot of people used.
Yes.
Fall asleep or drop asleep in the daytime. And then, of course, there are restless legs and people who have just tingling and numbness and crawling sensations over their legs, or they kick or jerk, and their partners will tell them so. These are the common physical problems, which mostly affect sleep. There are many others. start with or even finish enumerating them. So we'll just focus on the key areas here.
Well, we have a couple questions from our listeners. So Inspiring says, good morning. In clinical practice, what early warning signs indicate that poor sleep has progressed into a more serious disorder? Yes.
Question. And so, if you're talking about serious disorder, I believe it's for all physicians and all individuals to identify if they have metabolic conditions which are not well controlled. They've been going to their doctor, their blood pressure is not controlled, and somebody is needing more than 1-2 medications to control blood pressure. Maybe that is an eye opener saying, should I be looking into my sleep? Am I getting quality of sleep? So, if you're looking at indirect ways of identifying, if this is a serious problem now, or when a physician sees an individual with such problems, or if they have uncontrolled or fully controlled or early onset of high blood pressure or diabetes, that can be obviously as an indicator of something serious going on with your health, and probably always a good idea to interview such an individual about sleep related issues. And a lot of times we find an unmet burden of a sleep related issue in the background. And of course, in clinical practice where people come to me, they usually would present with extreme daytime tiredness, or waking up with unrefreshing sleep, having other conditions which are associated with sleep disorders. So again, if you're talking about how to identify, how would an individual know if their sleep problem has developed into something serious, are these warning signs where they're waking up tired. They've been told they snore, and people are telling them, or their wife or partner is nudging them to say, you're not breathing, you're snoring too much, turn over. They're waking up with headaches, so their migraines are uncontrolled, they're sleepy and tired. That would be an individual's, way of identifying something is wrong with them. Or
Yeah.
if, like I mentioned, blood pressure and sugars are not controlled. And regular heart rhythms and palpitations, those could be warning signs as well for a serious disorder.
Yeah. And, quite a number of years ago, I don't think Miss Joy is going to mind me sharing this story, but Miss Joy Basteo, a number of years ago, she had said to me that, I saw her and she looked so good. I was like, wow, you look amazing. What's been going on? And she said, Sandy, I had been diagnosed with sleep apnea, and I got this the mask. I don't think she has the full headgear, but she has like a smaller one that she found worked well for her. And she said, it's just so amazing how my life has improved. I mean, she was saying how she came off of so many medications. She was losing weight. Just overall, she saw this immense improvement in her quality of life. And she was so shocked to understand that this is all related to a undiagnosed sleep apnea condition. And so as a result of that, she made a lot of changes in her life. So when Inspiring talks about, how it is presenting itself in other ways, high blood pressure, she again reduced her medications that she was on to control her high blood pressure. I think by like half or some ridiculous number. Like, it was just such an impressive improvement. So I suspect there are times that we don't recognize how some of these other ailments, diabetes, high blood pressure, stress, emotional distress, how it is actually being impacted by poor quality sleep. So Inspiring has another question. What role does unresolved stress or trauma play in persistent sleep disorders? So when we talk about some of the causes of this, do we know, what role stress or trauma plays? I imagine stress would be a pretty big one.
That is true. It's, if you do look at surveys that have been conducted, and again, I'm not quoting any particular survey, but if you look at surveys world over, there's enough data to say, and for a lot of, subjective assessment, when we ask individuals about what is contributing to poor quality of sleep, a lot of them quote stress and anxiety. And it's a huge contributing factor behind insomnia. And I'm sure Deepesh will vouch for it, because he does do certain behavioral therapies or helps people with insomnia as well as part of his sleep education and other things. that it is a huge factor, at least definite perceived factor, and it's a huge contributor to insomnia for sure. People who
Mm-hmm.
sleep or can't stay asleep. In fact, a bulk of people with insomnia will have something they associate it with, and which is
Mm-hmm.
usually stress or anxiety or situational issues at sometimes grieving, sometimes things they bring back home from work. So it could be many factors, but yes, this is a huge contributor to insomnia for sure, or poor quality of sleep.
Mm-hmm. Mm-hmm.
And so that's the emphasis, see, sleep is a very holistic branch. It cannot be talking about only sleep studies, and which we would love to, identify the problem, but we cannot only talk about, one thing that has to be treated. It has to be a holistic thing. It has to be a lifestyle approach. It has to be identifying your underlying issues. We have to work sometimes hand in hand with people, with psychologists or psychiatrists or therapists
Mm-hmm.
who will help with sleep related issues. And maybe Deepesh can elaborate a little bit more about how to manage stress and trauma, which we always try to encourage people to do to
Mm-hmm.
address insomnia.
Hmm. All right, very good. Now, this one is really, really quite important. I think we all know this, but here we go again, just bringing it home. Diabetes connection. Wow. So, genetic insomnia liability increases type 2 diabetes by 14.2%. That's a significant increase. That's not a little number. So for those of you who are suffering from diabetes, I think it's important that you pay attention to that because wow, that's significant. Let's talk about the causal link to central obesity, hypertension, and oh, what's this fancy word? Let me see if I can get it. Dyslipidemia.
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 Sorry, I had to interject.
Dyslipidemia. What on earth is that?
High cholesterol levels and
Oh.
so that, like I said, this is a part of metabolic syndrome: central obesity, high blood pressure, elevated cholesterol or triglycerides in the blood.
Uh-huh.
And of course, people who have sleep apnea are or significant sleep apnea, moderate to severe sleep apnea, may be at a 3-time increased risk of developing diabetes, and vice versa. People who have diabetes, at least 65% to 70% of them may have an underlying unidentified sleep apnea. So
Uh-huh.
it's a huge causal association.
All right. So 936-2626. Just a reminder that the phone lines are open. If you have a question or comment for our guest this morning, Health City, talking about World Sleep Day, which was on Friday. So the 3X warning. 3X is the odds of type 2 diabetes if you have a combination of insomnia plus less than 5 hours of sleep. Oh. Wow. So does that mean that you're 3 times more likely to become a diabetic or get type 2 diabetes?
Very true.
Wow. Oh my gosh. Need more sleep. Team sleep. Let's go back to inspiring. He's talking about medical, non-pharmaceutical interventions. We're going to come to those right now. Inspiring. He says have been shown to be the most consistent in restoring healthy sleep patterns. So the one thing I love about the good folks over at Health City is they don't come in and right away be like, here's a tablet, just take this. No. In fact, what they do first is they will say, what can you do to help yourself? Let's look at your patterns of behavior. Let's look at the things that you can do and the things that you can change. So let's just have a look then at some of the tips. Inspiring and many others want to know, including myself, what can I do to get better sleep?
I'm going to let Deepesh answer this
Yes.
because he's always very keen on talking about, how we should be maintaining good sleep hygiene and educating people about it. So Deepesh, this is for you. What can people do without taking medications to help get better quality of sleep?
Yes, Mr. Deepesh, go right ahead. Number 1, I think he's still with us. Dr. Deepesh, are you able to hear us okay? I think we might have lost him, but
I
let's
think
just
we lost connection. So, well, I guess we'll probably be
yes. I
answer
felt
this.
I felt a little power surge just now, so I don't know if I'm the only one who felt that, but
Yeah, there was a bit of a noise in the background. I think he got,
yeah. So I don't know if that's a little power fluctuation, but
logged
anyway,
out.
I'm sure he'll be jumping back on in a second here.
I'm
Number
quite
one, keep a consistent sleep and wake schedule. So this is hard because we think we can make up for sleep on the weekends. Although I do see some information out there that napping might not be a bad idea. That maybe you can help to offset some bad sleep if you're kind of napping throughout the day. What's your take on that one?
So napping is good for people who have issues with, who do shift duty work or who have compulsions in their work life or, the nature of their work that they are not able to get enough time in the night to sleep. And if they take a short nap, and I always ask this question, and I'm going to probably ask you this, Sandy, because of course I can't set out a poll like right now for you. But how long do you think is a nap? That is my question. Just generally. Maybe I can ask Shamari and you. How long do you think is the definition of a nap?
I know
We're
when
reversing gears right now.
when I take
10
one.
minutes.
What did you say, Shamari?
10 minutes.
Wow. My definition of napping is I'm going to be out for an hour or two, but I'm sure that's not the right answer.
No, that's not. So I guess either one of them, or the answers are a bit the same. So a nap is typically defined as a sleep for about 20 to 30 minutes. So taking
Okay.
a power nap for 20 minutes and, in the day, and for people who are not getting enough sleep in the night, or for some reasons they have to do shift duty work, or they have to be awake and online at night because of the global work trends these days, that napping is good. Catching up on sleep over the weekend for people, especially who accumulate a sleep debt because of shift duty work again or compulsions, like I told you, could be fine, and it's a fair way of coping with cumulative lack of sleep, over a period of time. But to nap in the day and then allowing yourself to have delayed sleep time, to be able to watch TV or do something that is desirable, or you feel like accommodating in your lifestyle in the night, may not be a good idea. So for people who suffer with insomnia, so it's like I said, it's always subjective. So people who suffer with insomnia, perhaps taking long naps or rather sleep for a couple of hours in the day is definitely a very bad idea, and I'm sure they all recognize it. So maintaining a good sleep hygiene, whatever you have displayed on screen, is typically tips for maintaining good sleep hygiene, which is trying to go to bed at a consistent time and waking up at a consistent time in the morning. And usually, what I say to all my patients or people who come to consult with me is that try and find out what time do you need to wake up in the morning, and count back 8 hours, and say that's going to be my designated bedtime. Whether you can fall asleep very quickly or not, or whether it takes you a little time to maintain, or it takes a lot of effort to maintain that schedule, but try and find that time dedicated to this is going to be my sleep time. And then usually your brain requires training. And again, a term I shouldn't probably be using, but our brain is like a child or a pet. How do you habituate somebody to do the same thing over and over again? By conditioning it, right? By making that a pattern. And then you will tend to feel sleepy around that time once you create that pattern in your brain. And of course, it needless to say, don't consume a lot of stimulants, caffeinated beverages, especially if you're sensitive to them. Don't eat late at night, just before bedtime. Keep your environment quiet and conducive to sleep. So, dark and quiet environments are more likely to allow you uninterrupted sleep. So that's a good idea. Find a little time for exercise so you can sleep better in the daytime. Of course, not immediately before bedtime. And all of these things have better quality of sleep for sure. And that's one of the first things that we should incorporate when we are having sleep-related issues, whether it is sleep apnea, whether it's insomnia. Having a good pattern of sleep or a good sleep hygiene, it goes a long way. And this is one of the best things you can do non-pharmacologically to treat poor quality of sleep.
All right, folks. It was not our imagination. Something did happen to Dr. Deepesh outside of his control, as I suspected. I kind of thought that I heard, even my generator tried to kick in. So I can confirm that there are a number of individuals now. There's some sort of CUC power outage, but I think most people are still very much here with us, but it seems to be affecting the eastern districts, including North Side and East End. So, if you've got your radio on, you're probably still good, but here are the early details that we have, and I'm sure CUC will be reaching out. But we have a total of 15 outages, which is impacting almost 4,000 customers. So 3,731 customers are being impacted from the area of, just trying to see where that is in the map. But anyway, the eastern districts, all the way North Side, Driftwood, East End. Yeah, so we'll keep an eye on it. And I'm not entirely sure if our generator did kick in. Sometimes it's hard to tell. I heard the noise, but it's so efficient and so quiet. But we'll keep you guys updated. I'm sure they'll be reaching out to us shortly to tell us exactly what just happened. So it was not our imagination. Something did just happen there. So poor Dr. Deepesh. Looks like they've lost
He just texted
power.
me saying there's a network outage there and he's not able to connect.
Yeah, that's
Sorry about
okay.
that.
All right, no worries. All right, so some of the things that you can do yourself: keep a consistent sleep and wake schedule. Again, it's tempting to sleep in on the weekends, but try to be consistent with it. Avoid caffeine, alcohol, and heavy meals before bedtime. All of those things can be very, very disruptive. I'm not really a caffeine drinker in terms of coffee, but there are other sources of caffeine that you should be aware of. I'm also not an alcohol drinker, but the heavy meals sometimes do trip me up, Dr. Archita. And I do notice that if I don't give myself a good amount of time between a heavy meal and, that nighttime sleep, I'm going to have an uncomfortable sleep experience, sometimes even acid reflux and stuff. So more and more I'm recognizing that if I have to eat late at night, when you have these dinners and stuff, you either cut back on the quantity significantly or, go for a little walk afterwards or something to kind of feel like you can digest it a bit better. Create a dark, quiet, and comfortable sleep environment. I think we underestimate how important the dark room really contributes to good sleep. I was doing some reading on this more recently, and it said you should have absolute darkness if you can get it, right? And it's just amazing because when I do wake up during the night, the things that draw my attention are the little cracks in the blinds where a little bit of night light or outdoor light is still getting in. Last night, I remember getting up and going to the bathroom saying to my husband, "Why is that light on?" There was, one of those night lights, but you plug in all your stuff. Like there's a night light element to it. For some reason that was on last night. And it's so weird. But when I'm trying to sleep, it actually bothered me to see, I had a bathroom break, but still it bothered me to see that light on because, the brain is like, why am I seeing all this light? So, try to reduce the light that's coming into your room. Reducing exposure to screens and blue light at night. Can I just raise my hand for all these, Dr. Cheetah? Seriously, I go to bed with the phone in my hand. I wake up with it in my hand. So I'm like checking messages right up until the last minute. And I do know that it's not healthy.
And Dr.
You had your consult right there.
Oh, I know.
No sleeping with the TV on, Dr. Archita?
Bad idea, particularly if you have difficulty in sleeping.
Yeah.
Some people say it lulls them to sleep or allows them to sleep because it's a distraction. But watching bright lights, shifting screen, lights is definitely not a good idea for sleep concept. Our brain, like most human beings, we come from the kingdom of animals, isn't it? And primates. And for us, darkness is a stimulation to sleep. That's when our brain produces melatonin and that induces sleep. Now we will take pills and gummies with melatonin, but we will not, have our room dark and quiet and try to go to sleep. So, you could artificially augment sleep by taking certain supplements, which may or may not work for everybody. But more importantly, maintain it, with your lifestyle. That's extremely important. I think Deepesh is back online, so I'm glad he can talk, answer some of your questions too.
Yeah, absolutely. So Lavana says, my room is pitch black. She sounds like she's getting some good sleep there. Let's go to a few more comments. Abby says that my medical cannabis vape from Doctors Express does miracles for my insomnia. So vaping with medical cannabis. Somehow I have a lot of questions about vaping with anything, but how healthy is vaping? I mean, you might be trying to fix one issue, so you might be sleeping better, but causing, I mean, does she mean actual vaping when she says vaping?
Yes, I believe that's what is available here on island as a vape. I mean, cannabis.
But we know that
available as a vape.
vaping's not good for you, right? Popcorn.
So if you're
lungs,
asking a pulmonologist this question, you know what the answer is going to be. It's not good for your lungs.
yes,
And
of
any form of
course.
inhalation of chemicals, even though it may be medically prescribed, can sometimes have long-term impacts on your lung. And I won't even go there because that will be a long sermon in itself. But
Oh
vaping
my
and smoking
gosh.
of anything is not healthy.
Exactly. Yeah. Abby, try to find something else if you can't, honey child. I mean, I'm glad that something is helping you, but the vaping is what really has me concerned. See if there's something else you can do. All right. Strong Wilt says that Auntie Sandy, I just made an appointment to see Dr. Sandeep for my uncle because he's not getting enough sleep. So Dr. Sandeep will probably refer him to Dr. Archita or Dr. Deepesh if it's a real concern. So yeah, wow. Okay, good. Get him in there, Strong Will, so they can figure out what's going on with him. All right. Shaka says that don't hesitate to implement the use of a comfortable quality sleep mask, especially if one doesn't have heavy drapes to block out the sunlight. So these are the little eye masks that you can put on. They're not entirely comfortable for me, but I hear you, Shaka Zulu, that if they do work, then certainly you can utilize them. All right, stay physically active during the day. That helps. And I do find that, when I'm doing good things like Shamari, walking more, exercising, I do tend to sleep more soundly for sure. And persistent sleep problems should be evaluated by a physician. And I think for a lot of us, that's where we're struggling. Like, okay, is it persistent enough? What am I looking for? So let's talk about, we do have a caller in the line. Good morning, caller. Welcome to the program. Oh, hold on 1 second, my darling. I need to just unplug it and see if I can get you back there. Yes. Hi, good morning.
Hi, good morning. And good morning to the doctors.
Hello,
It's a
darling.
question I have to ask. I'm asking doctor, if a person have type 2 diabetes for years, can it reverse at any point?
Okay. I'm not sure if these are the right doctors to answer that question, but
I heard someone talking about diabetes, so that's
yes, but they're speaking about sleep and the connection between sleep and diabetes because they are experts in that particular area.
That problem with the sleeping. No, because I had type 2 diabetes for years, and my nurse told me last week that I don't have it anymore because I have cataract in both eyes, and I went and do my eye screening.
I'm not sure a nurse would be the one to give you that diagnosis, first of all, Miss Lucille.
Okay. I have been ready. I have it, but I wanted to get it full from El City.
Yeah. So I'm not a physician, but just what I know about, and
You better be one too.
I've read quite a bit about diabetes, but let's just take the more logical approach here, right? No nurse should be telling you. Yeah, no nurse should be telling you that because they don't have the training.
It comes from the doctor's surgery. But the nurses who do the blood tests and everything like that.
No.
My results
Let me ask you a question. Are you on diabetes medication?
Yes.
Yeah. So I would suggest, I know you're there in the UK and sometimes it's hard to get to a good doctor in a reasonable amount of time, but I would suggest getting in and maybe seeing your diabetes physician because there are experts specific to that and see what they can tell you.
But they are involved also. They are
involved?
But in the diabetes section also.
Yeah, but did they tell you that about your diabetes?
Yes, because what happened, I have the eye problem, the cataract and all that. It's a have small chance for to go blind or whatever. But I think I'll have to cut the cataract off the right eye pretty soon. But I'm proud to air, which I'm going to dig further, that the diabetes is reverse.
Yeah, get in there with a physician, because I don't know that they can just tell you that based on, it's not impossible. From what I understand, it's not that it's impossible, but it requires an extreme change in your lifestyle. Like you would know, I think, if your diabetes had reversed itself.
I did a lot of changes. I did a lot of changes.
Yeah.
And I believe what they say. But still, I'm going to dig deeper.
Yes. Get a second opinion on that one, I would suggest.
Okay.
Thank you, my darling. Have a good one.
Take over from Shamari soon.
No. Shamari is doing an amazing job. And contrary to what you guys may believe, Shamari showing up here weekly is not all that he does. He does way more than that. And he does an amazing job. And every time I see him at one of these, whether it's like a chamber event where they're, Health City sponsoring it, and he gets up and does a presentation, does a speech, I'm just like, no, sir, I don't want his job. He does an amazing job at it. But yeah, things like, it's interesting that she asked that question, but things like even blood pressure reversal, you've got to be really, really careful. Because I'll tell you what, Dr. Sandeep told me this a couple of years ago, because I was very optimistic. I'm like, oh, do you think I could lose a few pounds and come off of my blood pressure medication? He said, well, let's not jump to, any conclusions just because you've lost a few pounds. It's the sort of thing that a physician will want to absolutely be able to monitor you over a period of time. And maybe they could make some reductions in your blood pressure medication, then kind of reevaluate you. Because he said one of the worst things to do when you're on medication for things like blood pressure, and it's being controlled by medication, is to come off of it cold turkey, because then you run the risk of your body becoming resistant to the medication and getting it back under control. So you really put yourself in a much more precarious situation. And ironically, the last social event that I saw you at a couple weeks ago, Shamari, that birthday party, there was someone at our table. I think it was after you guys may have left, but there was someone at our table who came and sat down, and they were talking about their blood pressure, and they showed me their blood pressure numbers, 200 and something over. I only saw that first number, and I was like, what the heck? That is really high. I mean, I'm like 1 something, and Dr. Sydney's like, you better bring that down. I'm like 200 and something. And you know what she said to me? She said, yeah, I was on my medication, but I was feeling good, Sandy. And I decided to just come off of it. My jaw dropped. The little, the curry kunk that we were having that night, my jaw dropped open with the curry kunk in it. I was like, you just stopped cold turkey your blood pressure medication, and the doctor didn't tell you could do that? And she's like, yeah, because I was feeling good. I was like, oh my God. Well, there's a reason why they call a lot of these things silent killers. You can be feeling good and still have uncontrollable and high blood pressure. So now she's dealing with a situation where they're trying to get that blood pressure under control, and it ain't easy. So people, please be very, very careful if you've been dealing with a diagnosis like high blood pressure, diabetes, and all of a sudden somebody tells you you're cured. It's actually not that easy, especially if you've had it for years and you are on medication for it. It's simply not that easy to be like, I've had a miracle cure. And don't mess around with your medications, because you've got to follow the prescription instructions very, very carefully. Like some blood pressure medication, just as an example, has to be taken within a 24-hour period. Like if you get out of that 24-hour period, that will spike your blood pressure. So folks, read those instructions. Some of it you can't eat grape or drink grapefruit juice while taking it. Make sure that things that work counter to the medication, and get good medical advice. I know Miss Lucille actually isn't here in Cayman, so get a second or third opinion on that, because I would be very, very shocked if your blood pressure has all of a sudden just resolved itself, right? And again, when you start to have things like you're having eye issues. One of the worst diseases I think you can get is diabetes, because it takes such a significant toll on all of your organs, the kidneys, the heart, impacts blood pressure, eyesight, those external limbs, like everything. It really is quite an unwanted diagnosis. So keeping under control is really, really important. All right. The sleep clinic at Health City, of course, has been there for quite some time. I love how inviting and comfortable that bed looks and that entire room. So you can contact the good team over there, Dr. Archita, Dr. Deepesh, and they will actually have you come in and sleep at their facility. That's what the sleep clinic is for. Now, can I ask you, is the sleep clinic just at the East End location?
Right now, yes. So our sleep clinic is at East End. We
Okay.
do parallel studies usually at night for days when we do nighttime studies. Now, most people who are suffering from a chronic sleep-related issue will end up needing some form of sleep diagnostics. Some of them can undergo studies at home if they meet the right criteria, especially if this is for sleep apnea, screening, or other things. But mostly we are the only ones right now on the island to provide level 1 polysomnography, which is a full sleep test in the lab. And so that's, I think there's a picture of our lab right there.
Yeah.
But so the evaluation begins with the discussion. So they come in for consult, we have a chat, we decide what we need to do further. Is it going to be a test? Is it going to be a sleep study where you sleep overnight with some equipment on you? Or is it going to be just initially lifestyle management and what we talked about earlier? And maybe we don't have to start away with the study immediately and then plan it eventually when things change, with lifestyle management. So these could be, it's the onset of a discussion and then a plan for the study.
Yeah.
And yes, we are able to do a lot of evaluation during the sleep test and find out.
All right. So I'm sitting here and I know every time they're on, I always say the same thing, like, oh, I need to get in there. I'm going to ask the team, Shamari, have them reach out to me and let's make an appointment. Because I think I really need to just be honest with myself. Like, I'm being honest, but I'm not taking the next step. The next step is getting an appointment to come in there and see either Dr. Archita or Dr. Deepesh about it. Because even right now, I'm like, oh, I feel kind of tired. Like I could go back to bed.
Or
I could take my nap right now.
You could use your Health City Connect app to make the appointment.
Oh, I still gotta download
try out the technology and see how easy it is.
Man, I tell you. All right, I'm gonna.
So that you can tell people, how easy it is.
I gotta download it first of all. I've got to put it in my phone. I can't believe that I haven't done that either. Oh my goodness. All right, let me find it.
If that does not work, I will most definitely make sure. But I want to make sure every time Stephen is like, have you gotten Sandra to try that Connect app?
I'm downloading it right now. I'm gonna do it right now. All right, downloading. And it's sad because I've actually never downloaded it on my phone. Sometimes it gives you the option to re-download it. Turns out I never downloaded it. Okay, I know, I'm gonna try that. All right. Yep. See, I'm doing it right now, folks. Look at that.
Right. See,
Health
Stephen,
City.
Sandy's doing it.
Okay. All right. So I gotta figure out. All right. So we'll go through that and I'll let you guys know how easy that is to do. And then okay, I'll make my appointment. So now it says that it's text me a number. Oh, fantastic. Oh, this is pretty easy. All right, we're gonna get that installed. Miss Barbara is reminding us, yay, thank you, Miss Barbara G. She says your first hour is gone, time for the squat. So we're going to get up in the name of, trying to take some of these, implement some. We might not be doing it all, but, little baby steps help. Some of the more proven health initiatives, we are now, for every hour that we're sitting, we're trying to get up and do a little bit of movement and do some squats. So will you guys be willing to join us this morning? I know Shamari is always up for it, but Dr. Deepesh, I don't know how comfortable you are maybe doing 10 or 15 squats with us. And Dr. Archita, can we challenge you with the squat challenge this morning?
Sure, you can.
Yay!
But then if I have a knee joint problem, I have a few good orthopedicians back in the hospital.
Don't worry. I know a whole group of great orthopedic specialists that definitely could be at your disposal. All right, Shamari, are we going to do it?
But I'm gonna get my steps in because I'm still a part of the step challenge. I noticed there are quite a few people ahead of me on this app that I
Okay. So I
That
understand
includes
that
my Sleep Lab team, doesn't it?
I understand that Rebecca has been giving you a run for your money there, Shamari.
Run for my money. She's running away with it. She's ridiculous, man. I wake up and she has like 8,000 steps already. I'm like, because she runs in the morning, so you know she is.
Yeah.
One of those people, right?
Yes. All right. Let's go for. Let's at least do 10 squats this morning. So we're going to invite everyone who can. If you're driving, please don't stand up. But maybe just do, little. Oh, look at Dr. Deepesh is really into it. So this is fantastic. So let's go ahead and count, folks. Radio listeners, you can do leg lifts or something else, but let's go ahead and get those squats in. We're going to start now. So we got 1. Yes, 2, and get it as deep as you can. 3, good form is important. 4, I love when our guests join us. 5, 6, 7. Shamari's walking the room. He's doing his steps. 8, 9, 10. Let's do 5 more. 5 more.
Really?
11. Go down for number 12. There we go. 12. 13. 14. And 15. Wow. Dr. Deepesh, do you feel it?
Yeah.
See, I managed to do 20 off the camera.
Oh, you did. Good for you. Good for you. So there we go. Ingrid is here for it. Hopefully she's done her 15 or 20 as well. Whew. Yeah, I can feel the heart pumping. All right. How many steps did you get in there, Shamari?
It hasn't recalibrated as yet because it takes a little bit. But prior to that, I had 800 steps. Oh, and gosh. Rebecca's already at 8,841 steps. So I catch up.
Wow.
In the night when I get on the elliptical, but by that time she's way above. So it's hard to catch her. I try and beat everybody else. Rebecca is that high achiever.
Right.
Leave her where she's at. but
Inspiring said, I did 30. Wow, good for you. Wow.
But sometimes when I see I'm close to her, I will wake up and go downstairs and walk around back and forth, just beat her before I go to sleep. But that's every once in a while.
So every little thing helps, folks. Exercise throughout the day, whether it's increasing your steps, walking, hitting the gym. Weightlifting is very, very important for both men and women, but women, menopausal women, premenopausal women, everybody benefits from lifting weights. So get out there and get moving. And it's all about living your best possible life. And Health City, every single Tuesday, they're here practically during the regular season, Medical Rundown Tuesdays, to really encourage us to, do better with our lives. Yes, there are times that you're absolutely going to need medical intervention, but a lot of times they're just nudging you to say, hey, adopt these healthier habits, because they really, really go a long way to improving the quality of your life. So our poll question is up, and I can tell you that so far, the majority of people, the question is, do you feel like you're getting good quality sleep most nights? Sadly, wow, 9-1 so far. So like literally 90% or more of you are saying that no, you're not. That's really, really shocking. Participate in the poll question. Follow us on our channels, and I'll report some results a little bit later on. But the preliminary numbers in, wowee, not so good. Honey chill. Shamari, are you surprised by that? Do you feel like you get good quality sleep at night?
Yeah. Okay. I also have a sleep app where I for my watch as well as for my phone, where it tracks everything. And for the most part, I know when I don't get good sleep, but for the most part, if I get to bed at a specific time, then I'm able to get decent enough sleep. I still have a young one that wakes me up around 2 a.m. So, sometimes if I can't go back to sleep quickly enough, then it will show on my app. But for the most part, with no disturbance of a child waking me up, I get good sleep.
Good.
All right, there we go. So big shout out to Dr. Archita and Dr. Deepesh, again, in recognition of World Sleep Day. We want you guys to get better sleep and do whatever you can to make that happen. Thank you guys so much for joining us today.
Thank you
you,
very much.
Sandra.
Thank you
Yes.
for having us, Sandra.
Thank you.
And I hope the take-home message is sleep better, live better. That's the theme for this year's World Sleep Day. So we want everybody to do that.
Yes, absolutely. Thank you so much.
Right.
And I've made an important decision here. I know it's taken me a minute to get there, but I'm going to go in and see Dr. Archita or Dr. Deepesh about my sleep. So I've downloaded the app and I will make my appointment because, yeah, there are some days that I really, really do feel it. So I know I need to do better. And so now the next step is maybe getting in there. So Sophia says, what about people with insomnia? They covered that, Sophia, as one of the sleep disorders, one of like 60. I can't believe there's so many. Looks like getting good sleep is kind of hard, but one of the more common ones is definitely insomnia. And so I'm not sure exactly which one I've got, but anyway, I know I got something. Big shout out to CUC. Most people have been restored. Just refreshed and got an update now. So it went down from over 3,700 customers being impacted a short while ago to now 766. So it looks like most people have been restored and they are still working on the outage map, but a significant number, I think this is maybe starting in the Beach Bay area, but a significant number have now already been restored. So that's good. That is really good. There's a couple of clusters in Georgetown and let me see here. Down in, it looks like the Swamp, Washington Boulevard area that have an outage as well. And there's like one customer in West Bay. I don't know what's going on with them, but they do have it on their map. So don't forget this map is actually really quite useful, letting you know where outages are being detected. So they obviously are aware of it and working earnestly to restore power. So there we go. Now we're down to 7:33. Sophia, you're late to class. Were you sleeping? That's okay. Get your sleep in, girl, but keep it consistent. So yeah, I'm gonna. That's my new goal for 2026. Get some better sleep. All right. So listen. Let me do a couple public service announcements. First of all, there's so many amazing activities that are coming up that you need to be aware of. I want you to mark your calendar for these. And give me 1 second here. I'm going to pull up one of them. And then we actually have a DART interview that we're going to play for you guys as well for the DART Hospitality School, which this interview was done a few months ago, believe it or not. And I'm just getting around now to being able to give you all the details on this because the registration, it's an active registration at this time. So KFest is well on the way. So I do want you guys to be reminded about that. It is coming up. It's really KFest 2026 is in full swing. From film and literature to dance, music, theater, and the visual arts, this year's festival has something for everyone. So go ahead and mark your date, folks, for this upcoming KFest event. So we have already started with Friday, March the 6th. Then we did the National Dance Company of Jamaica was here, March the 7th. So we're in the middle of it. Friday was the Cayman National Choir and Orchestra concert. If you missed that, you missed a really great time. And so now we have coming up, the next event is going to be on Wednesday. We have Floetry by Hilton Grace. And that's at the National Gallery of the Cayman Islands at 7 p.m. So if you can get out to any of these amazing KFest events, please do. I know the big one, which everybody wants to go to, is the Red Sky at Night. But don't forget that there is quite a bit of other smaller events leading up to that. But you're missing a real treat if you miss out on those. So everything from performances by the National Dance Company of Jamaica, K-Fest and film screenings in both Cayman Brac and Grand Cayman, late night exhibition at Mind's Eye. We've got the National Choir and Orchestra concert, the children's book, an author collection, or collective, my apologies, Flowetry, which I said is coming up, and an adult improv workshop, my apologies, for those who are ready to step into the spotlight. And of course, the festivities, everything kind of builds up to the spectacular festival finale, which is Red Sky at Night, which is just absolutely amazing, and an event that we always try to go to because it's lots of fun to see all of the artists out and about and demonstrating their amazing talent. And we really have a lot of talented people right here on our beautiful island. I can tell you that in our home, we have mostly Cayman artwork from one of the artists that we saw at one of these events. And we said, you know, we love your work. And we just went to his house, which is basically his gallery. And we picked out something practically for all the guest rooms. And there's a beautiful painting in our hallway, the one that leads to the studio, of it's of a lionfish, and it is big and gorgeous. And so he's a Jamaican artist, but he's been in Cayman for quite some time. So his work is just really, really capturing a lot of Cayman landscapes and scenery. And so it's nice to see, you know, artists doing their thing. And of course, support them where you can, you know. So yeah, so we're looking forward to the Red Sky at Night, which is going to be on Saturday, March the 21st. So you can scan the QR code for tickets. That's from 4 until 11 p.m. Yes. And they have live performers and everything else. So we'll be giving you more details on that. And in fact, I think they're coming on tomorrow's show, so we can dive into that a little bit more as well. The other announcement I want to make is the Cayman Connection Making Waves Awards nomination campaign is now active. So you are able, folks, to nominate Caymanians who are doing incredible things all around the world. So we as a community want to recognize these individuals, and that's what Cayman Connection Making Waves Awards is all about. 2026 nominations now open. So if you know a Caymanian who is living abroad, overseas, and they're making a positive impacts in their fields and representing Cayman proudly on the global stage, there are 9 different categories that you can nominate people for. So I'm just going to run through those categories now. It is health and wellness, environment and sustainability, education, STEM, inclusion, tourism, travel, and hospitality, sports, arts, culture, and heritage, financial, legal, and professional services. So if you know a Caymanian who's been living overseas for at least 12 months and is doing, you know, great work, this is your chance to recognize them. The nomination process is really, really quick and easy. Just visit caymanconnection.org/nominate. That's caymanconnection.org/nominate. And the deadline to submit nominations is April the 13th. So we want to make sure that you've got all the details in before that date. Don't wait till April 13th to do it. I mean, it's still easy, but let's go ahead and get ahead of the curve here and do it as early as possible. Yeah. Good stuff, honey child. So let me tell you now a little bit about the DART Hospitality Program. And they have opened up the registration. Let me just get the deadline because I feel like the deadline has changed. 1 second here. Normally they're doing recruitments in the month of February, but I think nominations have changed. So give me 1 second. I'm going to tell you the deadline to apply, not nominations, the deadline to apply for the DART Hospitality Training Program. Let me see here now. Honey chill. Right. Give me a second. Okay. So it just says that they're open. There must be a deadline somewhere. All right, let me see if I can get the deadline. But this is a 2026 DART Hospitality Training Program. It's a paid 4-month opportunity that could lead to full-time employment at some of Cayman's top resorts, where you can gain hands-on experience across a world-class properties. And that includes like the Kimpton, the Ritz-Carlton, Indigo. They've got lots of properties, by the way. And so you can go to dart.ky/hospitality, and then you're able to apply. Oh, yes. Application closes April the 6th. So you still have a little bit of time, April the 6th, and the program begins in May. So let me go ahead and share this interview that we did actually in October with a young lady, Miss Destiny and Miss Diane Connolly, who are, Destiny was part of the cohort that started last year in 2025. So give me 1 second. I'm just going to pull up this interview. It's a great program. If you've not heard about it, I'm going to suggest that you, reach out, go to the website. And I think that if you're interested in hospitality, maybe you're not even sure that you're interested in hospitality, this could really be a wonderful experience for you. So excited to be sitting here with Miss Diane Connolly, and she's got one of her students here. We're going to find out a little bit more about this young lady. Another cohort for the DART Hospitality Education Program, training program, has actually been completed. And so, Diane, we sat down a number of years ago and we talked about this program. I think you were just getting started then, if my memory serves me correctly.
That is correct.
So why don't you give us a little bit of an update on where you are currently?
Well, the program has completely grown, and we are so thankful for that, to see the interest that we've been seeing from our young Caymanians to be a part of this program. This is our 4th cohort, and we're so pleased. 55 young Caymanians have completed the program today.
Wow.
So we're very pleased. It's been not an easy road sometimes in dealing with this. Sometimes for this year, we had over 100 applicants. And from that, only 16 were selected for the training. And so it's very competitive. We really want people who are very much interested and wanting to know more about hospitality. The program, again, is about sharing that knowledge with young Caymanians. Many of them come and they're interested, but they're looking at front desk because that's what they know, or server because that's what they know.
Right.
The program is built about bringing more awareness about the different career pathways that are available within the hospitality industry.
Well, this is fantastic. A few years have now gone by. What has been the biggest challenge for you over the years since you began?
Definitely ensuring that the people who do apply understand that this isn't just a little work job. This isn't about collecting a paycheck. This is about learning and growing and wanting to be a part of this industry. The commitment and dedication it takes. This is not a 2-week program. This is 4 months of very intense, hands-on, plus classroom training. There's a great investment that's being placed in this. It is hard every year to have to vet everyone that applies and being able to tell them, unfortunately, you didn't make it, can you apply again next year? But we want them to continue to apply because they'll learn something every time they come back,
Right.
And also understanding what the world of hospitality really means is also another area that we would like them to really understand when they're applying. Hospitality doesn't stop. The hotels don't close down when you need a vacation.
Right.
It's constantly going. That means you will have to work 8 shifts sometimes. You will have long hours, but it's your commitment to providing that service and those happy moments for our tourists and visitors. That's very important.
Now tell us a little bit about how the program is structured. Are you using all of the DART hotel properties?
Yes, this year we actually extended it. We now have 5 properties
Right.
that are part of the rotation. Those properties are the Hampton by Hilton, the Kimpton Seafire, Hotel Indigo, the Ritz-Carlton Grand Cayman, and Bonnie Moon.
Oh.
So we've added
okay.
Bonnie Moon as
Yes.
well as one of the properties that they rotate through. There are 3 phases to the program. Phase 1 is more of an orientation, getting to know what each property looks like. They get a tour of the property. We talk about what expectations are about. Phase 2 is actually having Lynn University, who we partner with. They send 2 professors down and an aide, assistant trainer, to do 2 intense weeks of learning more about hospitality and tourism, the latest technologies and advancements in the industry, and also about career pathways, getting a better understanding of the structure that goes on in hospitality and hotels. Then they get to rotate. They rotate through each one of the properties, whether it might be 4 days, 3 days, they get to see the operations. Each one of our properties are branded differently. So they get the opportunity to see how each one of them run. Finally, they get a week of tourism immersion. So how can you sell our product if you don't know the product? And we do have some years that people have never been to some of the properties that we go to or of our attractions. And it's really important that they know the product. If they're going to go sell it to the visitors, if they're going to uplift and have that Cayman pride, they need to understand what's there. Then the final phase, of course, is position specific. So for 8 weeks, they're going to be in a specific position and they're going to be trained up with opportunity for full-time employment at the end of those 8 weeks. And that's when it gets hard because they really have to pay attention.
Right.
That is, they're going to be in that 8 weeks like they're in that job full time.
Yes.
That means being on time. That means doing the hours, having the schedule, taking notes, and really applying themselves. And those who really apply themselves are the ones that are going to get the job offers at the end. I'm pleased to say this year, every single one of our participants got job offers.
Wow, that's amazing.
We were very, very pleased about that. Again,
Yes.
it's their decision at the end of the day where they
Right.
want to take that,
Okay. Oh, fantastic. So we do have Destiny who's here, and she's going to tell us a little bit about her experience in the program. Now, what year did you participate? Was it this year?
It was this year.
It was this year.
That's right.
Okay, so when you were thinking about this opportunity, why did you make the final decision to go ahead and submit your application?
Well, honestly, I heard about the program through a friend. At the time, I was in UCCI studying, and then I took a break from school because I had some personal things going on. And then so I was home for a little while, and I decided I need to actually get up and do something. And I was lost. Honestly, I didn't know where to start. I had never worked a job before. I had never done any sort of internship or anything like that. So I was really lost. And then I remembered that my friend showed me this program. I read up on it some more, and I was like, this seems like a good opportunity. It seems like something like a good starting position where to get my foot in the door. And I was right. And so I applied for the program. And honestly, I was very surprised to be actually accepted into it. I know that it was a competitive program to be applying for, but I got in, and I thought that I would need more experience than I had, but it worked out for me, and I'm really glad I took the chance.
Yeah, so a first job, that must have been an eye-opener and scary all at the same time.
Definitely. I was excited, I was nervous, and I was honestly ready to make new friends. I was ready to experience new things. I was ready just to learn more about hospitality because I'm Caymanian and I'm very proud to be Caymanian, and I've always been Caymanian to my core. So I thought hospitality was the perfect industry to be in if I wanted to, share our island with others and just get to know new people.
Okay. What was the most exciting part of the experience during the program?
I think the most exciting part was being able to rotate through different positions, find out where I feel like my skills were best being portrayed. There were definitely some positions that I was more interested in the beginning. I came into the program wanting to pursue bartending and stuff of that sort, but by the end of it, that wasn't even on my radar anymore. There's been some positions that I didn't really enjoy too much, like back of the house kind of things, but I really found my place being in front desk and concierge and just places where I can really interact with guests a lot.
And I suppose, Diane, that's one of the benefits of this program, is that it exposes them over the course to different positions, different departments. So as you said earlier, they really get a taste for the variety of things that are available in, you know, a hotel and hospitality environment. So how many young people probably have a similar story where they come in thinking, I want to do this, and then at the end of it, they go, oh no, I found something else that I'm actually quite keen on.
Most of them actually.
Yeah.
So an exercise we actually do the first couple of weeks is they actually put down the areas that they would like to be in. And then we revisit it at the very end and they look at where they want it to be to where they are at the end of the program. There are a lot of them that come in and they have a better understanding of different roles. So some of them, for instance, go into housekeeping and they do a rotation through housekeeping. They come back and you're like, Miss Diane, that job is not for me. That is really, really hard. And they didn't realize how hard it was.
Right.
And there's some others who have found their niche by doing these areas. And, you know, we have one or two that are in housekeeping now that they are loving it, but they never realized that position was there. Yes, that exposure allows them to experience different roles and then see where they are best fitted for. Because even though they might say front desk, they may not understand that they're standing on their feet most of the day. And that is not easy for some. You know, so they have to find where they're more comfortable with. And I think that's what this program allows.
Yeah, no, it's fantastic. Looking back at why this program has been such an amazing success, the fact that the DART organization started this, or other, you know, young lady talked about Destiny being at UCCI. We know UCCI has a hospitality program. What do you think differentiates your in-house program to what else might be out there?
I think it complements what is out there. This is the next step, you know. It's one thing to have the classroom, definitely setting, because it lends to understanding better the background of hospitality. But I think this program is a hands-on. It is actually getting to experience it and see it and put what you've learned into action. Right. And I think that's the important part for most of us. So we welcome anyone else who's studying hospitality to apply, because this is the next step of seeing the real part of it, experiencing it, getting to know the people within the industry, networking. All of that is very important.
Yes. When young people look at this opportunity, they think, right, I'm going to apply, but there's 100 people or more in the future who are applying for a very limited number of positions. What should they consider that's going to make them stand out during the application process?
The real interest in hospitality. If they really are interested, and that comes across. There are 3 phases of interviews that our applicants have to do. The first is telephone interview. The second is a Spark Hire one-way video interview. And the third is in person with the hotels itself. So we give them enough room to be able, it might not be good on the telephone, but let's see on the other part where you can really convey yourself and your real interest in it, you know. I would invite, if those who are really interested, get to learn a little bit more about the background of hospitality, what it's all about the properties, getting to understand what you're applying for. Because a lot of times they apply and you're like, why? And they're like, well. So we want them to really look and research it before they apply.
Yes. Did you have, Destiny, any particular property that you were more interested in than others?
Well, in the beginning, when I first started the program and we did the tours of each property, I was most interested in, I would say, Bonnie Moon and the Hotel Indigo and Kimpton as well. I thought I just really liked the vibe of each place. But when I was actually doing the training in each position, in each property, those weren't the ones that really stuck out to me. I really enjoyed Hampton. It felt like a home. Everybody there was so welcoming. Everybody there was just really warm. It all felt like a big family. And so that's where, I thought that was the best place to be.
Yeah. So again, lots of opportunities, lots of little things that someone might find interesting to them about one property versus another property. So that's really amazing. Let's go through some of your success stories, Diane, because there's quite a few that have just, been, I think, amazing. So some of the alumni's, there's a young lady here, Patrice Williams. She was promoted to sales coordinator at Hotel Indigo.
That's correct.
That
Patrice was in our first
fantastic.
cohort. She was in our first cohort, and she is doing amazing. It's, of course, this is the opportunity. Doors open.
Yes.
And it's about how much you apply yourself. And again, that was one person. Patrice is very passionate about hospitality, and she applied herself. And they noticed that. And it's good to see her go into sales. And who knows where she'll go from there,
Yeah. No, this is great. You had a young man, Romario McLaughlin. He was promoted to the engineering administrator. And then in 2024, employee of the year, my apologies, back of house at Kimpton Seafire.
That's correct.
Wow.
Romario has done really, really well, has really stepped up as a leader in the area that he wants. And again, this is where opportunities are so available. People talk about advancements of Caymanians within the hospitality industry. It's happening. And you might see the big picture of it, but it's happening. And Romario is one of them. He's really applied himself as well. He's found his area that he loves, engineering, and he is really taking it.
Fantastic. Kiana Tibbetts, I love this one, pastry cook, and she was also employee of Quarter One for the 2025 award at Kimpton Seafire. So even in the culinary arts, you've got pastry cook there. That's fantastic.
That's correct. Kiana was one of those who completed her education, her bachelor's overseas, and came back and was looking to see how she can re-enter the industry here. So again, we really encourage those who are coming back from university. This is also a pathway in, a step into the world of hospitality, of where they want to go in their careers. And Kiana has done a really good job within the first couple of months of taking on the position to be given increased responsibility.
Yes.
And they noticed that, and definitely is a mentor for some of the others coming into the program.
Yeah. And I love that there's people who can do telephone service attendant, you can do front desk, you can do the spa. There's a real variety, reservations agents. There's so many different areas that you can definitely get involved in. Rhea Carazana, 2025 Young Waiter Award for the Cayman Islands.
That is correct. And
for all of the Cayman Islands?
All of the Cayman Islands.
Oh my gosh, this is amazing.
We had two of our trainees for this year, our graduates now, who we put forward for the competition. And that was Daniel, of course, as the other person. But they did so great. Literally, we had 4 days to prepare them for this competition. And it's 4 intense days where they applied themselves. We did practice. We had the help of the hotels. This is where it's great with this partnership, because they stepped in to help guide them as well, knowing the wines, how to open champagne, how to present, all of this. We were working really hard in the background for that. So Rhea is going to represent Cayman overseas in February next year on the global level.
Fantastic.
So we're very excited about that, and we want to carry. This is the pathway to lift our Caymanians up.
Absolutely, absolutely. And we were talking about strengthening the connection between, the education system and then the tourism industry. How critical do you feel like that is right now to actually do?
I think that's really crucial, and there are advocates at the end of the day in education, and that's why we introduced this year the educators hospitality training. That gives educators a 1-week immersion within the hospitality industry. So they spend a day at each one of our properties in the background, talking to those leaders, finding out what is it that they're looking for when someone applies. So when they're in the classroom, they actually know, they can relate that to the students. If you want front desk, this is what you should expect. If you want to work engineering, this is what you can expect. Because they now see it firsthand and they can bring that into the classroom.
Yeah, this is fantastic. Destiny, one final question for you. Did this experience shift your perspective on the potential for Caymanians in hospitality?
Oh, definitely. Growing up, I've never really saw many Caymanians in the hospitality industry. Like staying at hotels and stuff, I never really saw Caymanians as the face of the hotels and the hospitality industry. But I would say that hospitality is so important as a Caymanian. It's so important to keep our culture going. It's so important to share our culture with others. And I think it's really important for Caymanians to actually get their foot in the door in the hospitality industry. And I can say now, I can definitely see more and more Caymanians working in the hotels. Specifically, I would say in the Ritz-Carlton, which is surprising to me. But when I was doing my training there were so many Caymanians actually working there. And I'm so happy to see that. I'm so happy for me as a Caymanian to see that, because it's just a whole other industry that we never even thought about. You know, growing up, it was always banking, education. We never knew about the hospitality industry, and I think it's definitely somewhere that we need to be, somewhere that we need to show our faces.
Yeah, this is fantastic. And Diane, when you talk about, you said the most important thing is their passion, their love for the hospitality industry, but there are other skills, particular soft skills, communication, teamwork, a good work ethic. If you had to name sort of the top 3 of on the soft skill side, right? Because you're going to teach them the ins and outs of the various positions, but beyond that, what would you like to see them coming with already equipped?
Commitment. They need to be committed to it. That means coming on time, being there, and performing. Definitely communication.
Yes.
Life skills is something that we're working on a lot, and we understand coming in young, you wouldn't know all of that. So we provide that guidance too. We provide that life skill sets in part of our program. But also, even having that small interest, demonstrating the real interest in it. Because we ask these questions, you know, what is your real reason? What positions are you interested in? And if you're interested, I would expect that you would look it up, read up on it a little bit, you know. The other things we can work on. You know, conflict resolution, that's one of our training that we do as well. Communication, we work on communications. Public speaking, but we also work on the little things like opening a bank account, getting a passport, getting your acknowledgement letter, things that you need no matter what, and whatever job you get into. And I think that's important that they get that foundation as well. But when we're actually looking at candidates, we really want to see that spark in them. You know, what is your they mightn't have experience. You know, like Destiny, she came in fresh and but we saw the passion. And the energy and wanting to be a part of it. And that's really important.
What feedback have you gotten from your friends, Destiny? Are they surprised that you're doing hospitality when you tell them?
I wouldn't say they're surprised. I've always been the very outgoing person, the person who wants to meet new people, who loves interacting with people. So I think it's very fitting. I think everybody thinks that hospitality is a very fitting industry for me, especially my family as well. My dad always tells me that, he thinks the hospitality is a great place for me to be, because not only am I like super friendly and outgoing, I'm also very creative. And I think that hospitality is a perfect place to kind of express your creativity in different ways, problem solving skills as well. I just think it's a really great place to be, especially to extend your communication skills, and my family agrees with me and my friends agree with me as well.
And we do have a full range of people who apply. We have some quiet ones, really quiet ones. And it's looking about the area that they want to go into,
Right.
you know, and that they're well suited for. Some might not want frontline. Some want pool and beach, and they're doing a great job at it. You know, some want housekeeping. They can do what it is that need to get done, but they're going to stay back from the front, you know.
Yes.
One or two that are in the spa. We have Alexia that's in the spa right now. She's done a great job. She's actually one of them that was selected to go on our exchange program. So we do have an exchange program with our property, sister property in Anguilla. So DART does have 2 properties over there. One of them is the Four Seasons. And Alexia is one of them, just came back from there and spending 2 weeks of rotation over there to help her. And she's coming back to continue her role as a spa therapist, taking a spa therapist. Again, one of them, there's a pathway going. She came as a spa attendant and is slowly working her way into spa therapist. So definitely opportunities out there that can help elevate to the next level. And it does matter if you're quiet, outspoken. It's about wanting to apply yourself.
Yeah. Fantastic. So I'm sure people are listening to this interview thinking, oh gosh, I need to get in to the next cohort. So tell us a little bit about how it works. When do you actually start accepting applications?
So our online portal, which is in dart.ky/hospitality, and you can find a link there to apply. Applications will be open on the 2nd of February.
Okay.
And we would encourage as many to apply. The program will start the last week of May. But during that time, of course, we'll be doing our selection process. So 2nd of February, they can apply online at that time, and we will be happy to receive them.
Any basic requirements, age?
They would have to be the age of between 17 and 30.
Okay.
Caymanian. They need to have a resume, proof of Caymanian status, and at least a passport photo to upload as well.
Okay.
Or share that with us. So again, basic requirements. We're not, and they must have at least a high school diploma.
Right.
To get into the program.
Fantastic. All right. Well, thank you, ladies, so much. This is a wonderful opportunity to just catch up with the hospitality education program. Ms. Diane has been working on this since 2022, its inception, and things seem to be going really, really well. I'm so pleased to see the number of people every single year is increasing. Do you think you'll get to the point where you can accept more participants, hopefully?
We'll look at that in the future.
Yeah.
Definitely. It's still a young program.
Yes.
And so we're definitely looking into seeing how we can continue to build. The program has, again, extended much more between this main program, the educators program. Where
And this is the first year you've done the educators program?
Yes, the first year. And so we had 13 of them complete the program this year for the educators.
Right.
We have 2 exchange programs in place as well for those who graduate from the program or young Caymanians currently working within the properties that can be considered for the exchange program. One is with Flagler College in St. Augustine, Florida, and the other, of course, is in Anguilla with our property over there.
And if someone missed the participating educator, like that part of it, say they weren't aware, can they reach out? Is that something they can do at any
They
time?
can definitely reach out at any time.
Okay.
Again, that will be a portal that we will be opening for those who want to apply, and that will be again in February next year, when we can start looking at applications from educators who are interested in being a part of it. Definitely, it's had its impact already, and we're very pleased to have the educators' feedback on it and how they have been able to incorporate this into their curriculum. And we want to see that more. We want to see more people applying. So we're very excited about the partnerships that we're building.
All right, folks. So don't miss out on this opportunity. I would say if you have an interest in hospitality, find out a bit more. You can visit the DART/hospitality in February website in order to apply. And yeah, this sounds like a fantastic opportunity for anyone 17 to 30.
17 to 30,
Yeah.
Caymanians 17 to 30 who are interested in a career within the world of hospitality in Cayman.
Beautiful. Thank you, ladies, so much. Really appreciate it.
Thank you.
I would say to someone that's joining the program, be open-minded. Try to come out of your comfort zone.
There's so many opportunities to learn from these chefs that have been here for years.
It taught us different positions in the hotel. If you see a different position that you actually find interesting, you can actually do a little training. And if you want to, if the position is open, you can apply.
I applied for the DART Hospitality Training Program because it was a good opportunity to try to learn something new. No 2 days are the same, so you're never going to be bored. There's always be something to do, something to look forward to.
I would definitely recommend Caymanians like myself to apply for the program. You literally have nothing to lose. You're there to gain a lot of experience and knowledge. It's really crucial for us Caymanians to work within our industry.
All right, folks. So this is a great program. Again, the deadline for you to submit, if you're interested, is quickly approaching. They opened it up for registration, but the deadline is actually going to be the 6th of May. So applications will be closing the 6th of May. So you've got a couple weeks left. If you're interested in applying for the DART Hospitality Program, please go to dart.ky/hospitality. And I'm going to just put that link here at the top of the screen so that hopefully you can grab the details. Check it out. You don't have to be fresh out of high school. You can be someone with some experience, maybe looking at a career change or some different options in your life. You never know. I say check it out. You might be in for an absolutely amazing treat. And that young lady, Destiny, seems to have been having a wonderful experience. That was conducted in October, that interview that you saw there. This is the first time that we're getting to air it. But as you can see from her feedback, she confirms that she's gotten a placement. All of the people who participated this year were able to get placements, which I think says a lot for the success of the program. Now, of course, I'm cognizant of the time. So, honey child, where are my squatters at? And I don't mean squatters at the fish market. I mean doing our squats this morning. Let's get up, folks, and start to wiggle it and jiggle it. And we're going to do at least another 15 squats here in the next segment. And I'm just checking a few news details here. So big shout out to CUC. Their team is working very, very diligently this morning. The outage map now is down to just 67 persons. So there's some isolated cases, but that big outage from earlier today that had over 7,000 people without power, they have largely now been restored. And it looks like there's just a couple clusters around West Bay, Georgetown. There's a few in, I think I can't see what's before the bay. So I don't know if that's, hold on, let me show you guys this image. Something Bay, it says in this picture here in the map. I'm not sure if that's, let me show you. Oops, hold on, remove that one. There we go. What is that right there where you've got those clusters of the light colored and the dark colored blue? Anyway, but it's like right after the Frank Sound Junction, it looks like on the outskirts there. So a couple isolated cases still based on the outage map. Basically, we're looking at 67 people in total. So there's one kind of in the Bedford Estates area. There is one, so that's Lakeview Drive. Oh yes, I see how I can get more details. So this one is Northside Road. So that cluster up there, that's all. One is Bernard Drive off of Northside Road. And then we have another cluster here that is north side. So north side still has a few out. We've got Belford Estates, which is Lakeview Drive. A few people there being impacted. And then we have some in Georgetown that include Commercial Crescent, Lancaster Crescent, and also, let me just see here. Archive Lane seems to have a handful of people. That's and one customer there, and then one on Fern Circle, one Mary Street. Then there's one on West Bay Road. There's another one on Turnberry Drive. That's heading, I think that's right off where the golf course is there on West Bay Road. And then one more in West Bay and Simeon Crescent. So isolated instances of some outages totaling 67 individuals. And yeah, they're going to be working on those quickly. So those are now isolated. So that's good. All right. That's saying Old Man Bay. Oh, yes, that would make sense. Thank you, Marshall. I was trying to figure out what kind of bay. What's the bay up there? Old Man Bay. Yes. Thank you, Sophinia, for that as well. Ms. Sue says we were lucky in Savannah today. Yeah, I don't know what caused the outage, but it seems like it was resolved rather quickly. So that is fantastic. So I saw a question here from Miss, let me see now. Venetia says that I keep hearing that magnesium is good for sleep. If so, can you recommend the kind to use? I know there are different types. Thanks. Venetia, that's a wonderful question. And my apologies, I did not see it before our guests left, but I myself have actually been doing some research on this, and I'm going to share with you what my research has found, because you're absolutely right. It's the type of magnesium that really does matter. Now, I know Mr. Elard has responded saying that seawater is high in magnesium, the most healing and critical mineral at a cellular level than the salt sodium in the seawater, especially if you can soak for 45 minutes, even 3 times per week. And imagine that our ancestors knew the healing properties of taking a dip in the sea. Well, this is not the same type of magnesium that she is actually, Venetia is inquiring about. So I want to be careful and how we respond to that, Mr. Elard. There's different types of magnesium. So the type of soak that you're talking about is not actually supported by current evidence. I mean, yeah, soaking in salt water is fine, but that's not how you take in magnesium. How you take in magnesium, into her point, Venetia's point, is you actually have to ingest it. We're talking about food-based magnesium. And so obviously the primary source for our supplements is always food. Our intake, our nutrients and stuff. Primary source, always food if you can get it in your foods. But supplements can be also a proven way to get enough magnesium. So sea salt and seawater does contain magnesium, but its concentration is far lower, than specifically prepared magnesium-rich foods or solutions such as dead sea salts used in studies. So again, we can point you in the direction of those studies if you'd like. In clinical tests of bathing in magnesium-rich dead sea salt showed better skin hydration and barrier function, but it does not prove significant whole body magnesium absorption or treat systemic deficiencies. So there's a couple different things going on here. When you talk about an outside source that has a magnesium that you can soak in, that's not quite the same thing. So if you look up transdermal magnesium, that is what I think Mr. Ellard is talking about, how it can penetrate the skin's layer. That's not what we're talking about. We're talking about diet and supplementation. So basically, major health bodies state that adults generally need between 310 to 420 milligrams of magnesium per day. Again, from food, mostly from food. That's your best source. And magnesium can be found in healthy things such as nuts, seeds, whole greens, legumes, leafy greens, and fortified foods. And these things are all well proven to maintain normal magnesium status. If your diet is insufficient or there's some sort of deficiency that's documented, or supplements are well established and measurable way to increase your body's magnesium stores. And yes, to Venicia's question, research does suggest that magnesium can help with mild insomnia and anxiety, particularly in people with low magnesium to begin with. And for sleep, many clinicians prefer magnesium glycinate. So this is where it makes a difference, because it's well absorbed and tends to be calming with fewer digestive side effects. And typically those supplemental dosages are in the range of 200 to 350 milligram of elemental magnesium per day. And that's staying within the usual upper intake limits for supplements plus food, depending on your sex and age, obviously, unless a clinician advise otherwise. So I'm going to show you one that I take. There's a few physicians that I do religiously follow that have proven, they're qualified and they have proven their chops to, really keep on top of these things and be in the know. And so let me show you the magnesium. I actually gave some, I need to check it. Was it Kevin I gave a week's worth? Because he's supposed to be taking it because he has sleep issues too. And I was going to check in with him to see if he had been taking them. But let me show you the one, and you got to get really good quality supplements. I know sometimes we just run into any pharmacy, we grab what's there, but the supplement industry is not highly regulated. And so you've got to do your research to make sure that what they say is in it is actually in it. So it's very, very critical that you do the research. And this is the one that I have found that I'm actually taking. And I must admit that a lot of nights I forget to take it. That's my problem. So I need to be more consistent. But when I do take this, and this has got the L-theronate version in it, it supports cognitive health, vegan, gluten-free, non-GMO. And this is the one that I actually take. And it is available on Amazon. I haven't seen it here. Again, it's not cheap. It's about $60 for the 180 count tablet. You can get the 90 count for basically $30. But, for $20 more. Well, I guess for double the price, you're getting the 80. So it's like the same thing, I guess. But then you don't have to buy it as often when you get the 180. So this is the one that I take when I remember to take it. And they recommend taking it about an hour before bedtime because, and I have definitely noticed that it helps with my sleep. My apologies. When I've taken it for a couple days, it definitely has made a difference for me. So check it out. Do some research. Don't take my word for it either. But this is what my research has found. And there are, I'm sure other brands out there that you can look at as well. They recommend 3 a day. I don't normally take 3 a day. Normally I take 1 per day, right? Like an hour basically before bedtime. Yeah. And the other thing I'm starting this week, which I'm trying to be more diligent with, is I'm actually doing creatine supplement, and that's in powder form. And I'm trying to drink that at the beginning of my day just to, use basically, I'm drinking it right now. This is it's settled at the bottom because it is so I kind of stir it up. I drank half of this already. So I need to drink the rest of this water. Ooh, drinking water is hard, but creatine, good for the brain. I'll finish the rest in just a minute. So yep. Are you still on YouTube? Yes, Mr. Horace. What happened was our primary YouTube channel got blocked. So we are still on YouTube though, because we have a backup channel. So let me just find the backup channel for you. If you go on YouTube and you search for Cayman Mall Road, Cayman, that will take you to the correct one that we're on now. I recommend following both. So if you just go up to the top, type in Cayman Mile Road, Cayman in YouTube. Let me show you what it looks like, because they do look a little bit different. So 1 second, sir. Give me 1 second. All right. So this one here now, this is the current channel that we're live on until June. We're in Facebook, YouTube jail. So this is it. It's the one with the little gold pendant. Big shout out to David. This was a pendant some years ago. Actually, I'm wearing it today that he made for me. And it's like one of a kind, custom made. It says CMR, Cayman Mile Road. I love it. It's beautiful. And so this is where we are live. So the only difference in the name is this one's at Cayman Mile Road and then Cayman at the end. Subscribe to the channel. So let me put it here in the comment section. Yep. Subscribe to the channel. And this is where we're live until June. All right. We've been live the last couple of days there. The regular channel, this is the difference, just says Cayman Mile Road up at the top, and it looks like this. So if you go to the regular channel, just add Cayman on the end of it, and it'll take you to the backup channel, which is this one here. Okay, so follow them both so that you'll get notifications when we go live. And the easiest way to get the links every single day and to know where we are, Mr. Horace, is to simply join our WhatsApp channel. And you can join the WhatsApp channel easily enough. And yeah, when you join the WhatsApp channel, we send out the links, we update them daily, and you'll be able to get it directly in your inbox as well. Okay, so happy to share that link with you. Wow, the results are the majority of people in our poll question of the day, do you feel like you're getting enough quality sleep? Most of you are saying, no, you are not. I'm shocked by the numbers. I am. Oh my gosh. Okay. Let me get you some details, and hopefully people are still going to be participating in this. Hold on 1 second. Wow. I'm surprised by this. I am not going to lie. I thought maybe it'd be like 50-50, like 50% saying, yeah, I'm getting good quality sleep. The other 50% like, no, honey child, not tonight. And so this is a question about the majority of time. And most of you are saying that you are not. Good to know I'm not alone, but still not good for community and our health. So essentially we have 88% of you saying, no, you're not getting good sleep. 88%. That's wild. This is an overwhelming number, in my opinion. Basically, nearly 9 out of 10 respondents feel that you're not getting good quality sleep. Damn. We need to do better. We need to do something about this. Okay, honey child. I mean, I'm going to do something about mine. I'm going to make that appointment. This is like public health crises right here. Whew. Wow. So if 90% of the people aren't sleeping well, what's happening in our society that's keeping us awake? My goodness, this is pretty wild. But yeah, that might be explaining a lot too about what's going on with some of our health issues. All right. All righty, honey child. Let me see here. Please give me a call ASAP to announce an urgent meeting for tomorrow evening. Okay. Okay, good morning. All right. Okay. Okie dokie, honey child. Thank you so much. You're welcome, Mr. Horace. Barbara. Oh, yes, another hour. My apologies. Get up, get up, get up, get up. Barbara's on it this morning, boy. Yes, sir. She keeping us all going. Let's go ahead and do another. We did what, 15 last time? I think we can at least do another 15. Not for nothing, but were you guys, was I the only one who noticed that Dr. Deepak was like, those 15 really kind of had him breathing heavy? I wonder how many steps he's doing in the step challenge. Ooh, honey child. So many of us used to sit down all day that when we get to squatting, it feels like we are, getting a major workout when really we're not. But that's why we got to keep at it. The body gets used to what the body does. So that sedentary lifestyle killing all of us. So let's get up. Thank you, Miss Barbara. At least 15 more. Okay, ready? Everybody ready? I feel like at times like this, we could do some music. Let me see what I have in my. I do need to work on some of my my assets and stuff. But let me see what music I got that can get us going. We have. Let me see. We need some heart pumping music. I don't know that I have any heart pumping music on here. What is this bounce thing? Oh no. Drum roll. Okay. Gosh, we need some music in the lineup here. We ain't got no music to get moving to. All right, let me me a good soca song or something. Lord have mercy. We got country, which is gonna be too slow. That's not the vibe. We've got our politician song, Well Done. That's not the vibe either. Oh.
Hey, K-Man, lo saluda DJ Yoyo.
Shake it and I jiggle it. All right, let's go. All right. Put your hands out. Yes, to give you a little bit of support. Let's go down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right. That's the most I can do today. But listen, it adds up throughout the day if you do that every hour on the hour. And you're sitting at your job for 8 hours a day. You do the math. I can feel my little heart beating a little bit. Soca's the best. I put it on every day, says Miss Sue. You go, girl. All right. Thank you, Miss Barbara, for the reminders. So look at that. We've already done at least 30. Plus I did some more earlier. So more like 45-ish. Okay. Okay. All right. All right. Thank you so much. And yeah, get a standing desk, because sometimes at our desk, instead of sitting all day, we could actually do with standing. So I like what Shamari was doing earlier, where he's like, no, I'm going to walk around the office, right? So little things like that can really make a difference. Oh, yes. Big breaking news this morning. About to post this one up. Joseph Kent, who's the director of the National Counter-Terrorism Center, has resigned this morning. He has said that I cannot in good conscience support the ongoing war in Iran. He said it has been a horror to serve under President Trump. Oh my God. No, sir. People are finally waking up. Listen, all I can say is hallelujah, praise the Lord. It's a sin to remain stupid all the days of your life. Amen to that. But anyway, yeah, I'm actually working on posting this. His wife was actually killed by ISIS, and he quits after saying that the Iran war, Tehran posed no imminent threat. Mm, mm, mm. He also went on to say that it was clear that the U.S. war in Iran had been started due to pressure from Israel and its powerful American lobby. Good. So good when people finally have had enough and they stand up. Took you long enough, I must say. And he goes on to say that it's been horrible. He said that this was a lie and in the same tactic the Israelis used to draw us into this disastrous war, the cost our nation the lives of thousands of our best men and women. We cannot make this mistake again. So he's saying that, he has a history as a combat veteran, and he's a widower whose Navy crypto-analyst wife had been killed in an ISIS bombing in Syria. And he says that he can no longer support this foolishness that this administration is doing. But the administration is saying, look over there, over there, over there. No, over there. So they're starting to deflect already. And the deflection this time actually involves the poor people of Cuba. They're going to go after the Cubans next. Listen, I'm not saying that Cuba doesn't need liberation. I'm just saying that have we not seen that what the U.S. is doing right now is not going to be anywhere close to liberation? It's going to be nothing but a clusterfuck. So y'all going to go from bad to worse. Come on now. Come on, poor Cuba. Lord Jesus, take the wheel. Cuba deserves better. I feel it for the people of Cuba, but this is not your knight in shining armor that you're actually looking for. That much I can assure you of. So, one more came to his senses today. That's a very, very good sign. Let's see where it goes from there. So yes, thank you so much to that person who shared it, but I actually did see it. And I was in the process of getting the design ready to print this on our platform. But what a mess, sending shockwaves through the world. Ay. Just unbelievable. Unbelievable. Well, honey child, there you have it. All right, I got to get to work. I got a lot going on. Okay. Yeah, I've got a lot of work going on here today, honey child. So let us get on it. You guys have a beautiful day. And Mexico government going to send oil to Cuba. Well, they have been sending some, but it really is not enough. I think most of you saw the story that we covered this week where the Cuban government is like, shit is just shutting down. Like, it's not good. I mean, it's horrible, actually. So Cuba has declared an option 0 emergency as fuel reserves total collapse. So this was, I believe, on Sunday that this story went up. If you missed it, please go and have a look. The Cuban government has issued an extraordinary emergency declaration on Friday, warning citizens that the country is on the brink of a total energy and infrastructure collapse, which it calls option 0. A scenario involving the complete shutdown of electricity, transportation, water, and communications nationwide. It's a very rare and starkly worded communique from the National Civil Defense General Staff. Cuban authorities said that the crisis stems from a severe disruption in the company's external fuel supply chain, combined with the near total depletion of domestic reserves. So it's not good. So this emergency scenario, is just, wow. Those poor people. I don't know what to say. What I do know, my apologies, is that the U.S. actions right now is what is placing this immense pressure and chokehold on an already strenuous situation for the people of Cuba. And so, we'll see what happens, but it's not good. Anyway, we'll continue to monitor it. and update you guys on, any changes in that situation. We will put up this latest statement now from the counterintelligence head of counterterrorism out of the U.S. And as these people continue to drop like flies, what he does is he puts even less qualified people, because most of them weren't really all that qualified to begin with, but he will then put even less qualified individuals in their position, which is kind of scary, because he'll put like his, the kitchen chef will be the next one to go in there and become the counterterrorism expert, supposedly. So keeps getting from bad to worse, if you ask me. All right. I think that's all I got for you today, honey child. Tune in tomorrow. Like I said, we've got some guests joining us, and we'll continue the discussions. Go sign up for the DART hospitality program if you're interested. dart.ky/hospitality. Come on, Caymanians. Step it up, step it up, step it up. Get involved in be the faces, at least one of the faces that someone can see in a restaurant or hotel. Let it be a Caymanian face and beautiful Caymanian voices. See you guys tomorrow. Have a beautiful day.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.